Hey guys, today we're going to go through some self-myofascial release for the neck and jaw. If you clench down right now, you're going to feel the first muscle we're going to release, which is your masseter. It should push into those fingertips. This is located from the base of the jaw all the way up towards that arch of the cheekbone. Take your fingers and gently glide them up towards the cheekbone while you simultaneously open the mouth. Now, the key thing here is to keep this very gentle. You want to sink in with some firm pressure, but you don't want to be pushing so hard that it's uncomfortable. You can do about 2 to 3 passes per area and just take this all the way down the jawline towards the medial portion of the cheekbone. You'll need clean hands for this next release for the pterygoid muscles. These are located inside the jaw. So you're going to take your thumb or your pointer finger, place it inside the opposite cheek, almost along the upper teeth. You're going to sink the thumb gently in until you find a tender spot towards the back of the jaw. Once you're here, take a few deep breaths or even just move the jaw side to side. You can repeat this just up and down that same area in the jaw a few times, and then we'll move on to the lateral pterygoid. So for the lateral pterygoid, this is going to be a bit more posterior and superior, so you're just going to angle the thumb up slightly. Again, this might be a little bit tender, just gently press in. You can decide to slowly open and close the jaw, move the jaw side to side. The pterygoids are key for coordinating the chewing movements and helping us laterally move and protrude our jaw. Last but not least, we have our sternocleidomastoid, otherwise known as our SCM. This begins at our collarbone and sternum and runs obliquely along the lateral side of the neck. Now, if you rotate your head to the side, you're going to feel this muscle pop out. Go ahead and grip that between the thumb and pointer finger. And then you're just going to gently move that tissue back and forth really, really gently. You can rotate the head, tilt side to side. Do this for a few reps and then just begin to walk those fingertips up the muscle belly. And you're just going to continue to do this all the way up towards the back of the jaw. This muscle is really important for posture. It oftentimes can get short and tight with forward head positioning, and that can affect our jaw. Now, if that was difficult for you, you can also just try pinning the bottom of the muscle down and then gliding those fingers up along the muscle all the way towards the attachment towards the back of the jaw. Again, you only need to do a few reps here. You don't want to overdo it when you're doing soft tissue release.